Here we go. So this is the thumb. So we do an AP thumb unless otherwise indicated. How am I going to get her hand and her thumb in an AP? Go back to anatomical position as to what's anterior and what's posterior. So this would be the anterior side of the thumb. So she's got to flip her wrist over. Where are we centering for the thumb?
The interphalangeal, no.
Metacarpophalangeal joint. But I want to include the CMC, the carpometacarpophalangeal joint. So long axis coming straight down the thumb, centered at the centered at the metacarpophalangeal joint, but I'm including my collimation, the carpometacarpal joint, okay? Right, marker there. Some patients, you're gonna have this area, this little fat pad on the side of our hands, it's gonna overlap right here. If that happens, you can get them to take the other hand and hold the fingers. Just make sure their fingers aren't in your field of view. I'm looking at the fingernail, making sure her finger's nice and flat on my IR. There's no rotation of the fingernail. So when I actually expose, I should see the concave sides even on both sides of the phalanx. Questions about the AP thumb? Okay. The PA thumb is probably the easiest of everything. You just put the hand in a PA. Let's do oblique thumb. I'm sorry, not PA. Oblique thumb is the easiest. We're going to do a hand in a PA, and your thumb automatically goes into an oblique. Can't get much better than that, can you? Right marker. Centering to the metacarpophalangeal joint, including the carpometacarpal joint. Questions about the oblique thumb? Lateral thumb, get her to ball a fist up for you from that. Stick that thumb out. Keep it straight and just roll the wrist up until you get the fingernail in profile. Still centering. And just kind of throw those fingers back. That's your lateral thumb, still including carpometacarpal joint. Questions about that?